Hi, it's Bill, the knee pain guru. Today, we are going to talk about how to get rid of knee pain. We're going to go into that in just a moment. We will be answering questions after the presentation is done. So if you have them, put them in, enter your questions in the comments section over on the side. If you have questions about your knee pain, your diagnosis, doctors, physical therapists, whatever the question is, please put those in over in the comments section and we will address those in just a few moments. Please make sure to give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, and turn on notifications because I do these videos twice per week, so you would become aware of when I am going live and participate in these live presentations. So we're going to talk about now how to get rid of knee pain. And specifically, I'm going to talk about how to get rid of knee pain from the perspective of beginning to introduce comfort to the knee. From my perspective, how I see it and how most bodies function is that if you have something in pain, the fastest way to get out of pain is by creating comfort. If we use logic and reason on that and not like how much education a person has or an understanding of anatomy and physiology, if we kind of push that off to the side and just go with a common sense perspective of you have pain, you have nerve irritation, we get the pressure off of that nerve, you're going to get relief pretty quickly because we begin working with your body's capacity to heal itself. Before we get into it, though, I want to make sure, first and foremost, go to your doctor, get a diagnosis. This is crucially important because it's important that we understand what is going on in the knee. If something is broken or torn in the knee, it's a completely different strategy and scenario than if nothing is broken or torn in the knee. And this is what many people with knee pain are facing is they don't know. They haven't yet gone to the doctor to get an x-ray, a CT scan, an MRI to get an official diagnosis to know which way, what is the strategy. The source of both of those pains is from nerve irritation, but if we're just talking about pain, we're not talking about a mechanical dysfunction, something being broken or torn, then we're only talking about nerve irritation. If the nerve irritation is caused by something, torn ligament or tendon or meniscus, or you have a fracture in the bone, we have to address that physically first in order to get the knee to be able to heal as quickly as possible. So do that first. Get a diagnosis from the doctor, make sure nothing is broken or torn. So I'm going to give you 5 steps specifically for if you don't have something broken or torn in the knee. So your knee is normal. Nothing is coming up on an x-ray, a CT scan, or an MRI. The doctors are saying, I don't know what to tell you. The knee is fine. We don't have any diagnosis for it. And so these 5 steps will help those people. First, identify the area of the knee that hurts. It sounds super simple, but a lot of times the mindset is the knee hurts. There's a lot of different parts to the knee. There's the kneecap, there's the tibia and fibula in the lower part of the leg, there's the femur in the upper part of the leg. We have tendons, we got ligaments, we got fascia, we got fluid and bones and meniscus and cartilage. So there's lots of different elements that can hurt, where the nerve irritation happens, and that can cause pain. We don't have to get into exactly what those anatomical parts are. However, being able to take your finger and point to the spot that hurts, be it the kneecap, be it inside below the knee, be it outside above the knee, the back of the knee, below the knee joint. These are all drastically different places. And So the first step is identifying the exact place that hurts. This is going to be hugely helpful in terms of moving forward and relieving the pain of what's going on. Step 2 is using the intrinsic movements of the knee joint to get the pressure off of the nerves of the knee causing the pain. So there's 2 major ways the knee moves. Most are familiar with the gross motor movement of the knee, which means the knee extends, the knee bends. Gross motor movement. That's when you go to physical therapy, when you're trying to strengthen the muscles in your legs in the hopes that the knee pain will go away. They are focusing on the gross motor movement. Leg extensions, leg curls, leg raises, calf raises. Those are all functioning with the gross motor movement of the knee. Now we're going to look at the intrinsic movement of the knee. The intrinsic movement of the knee is where the pain hides. Their intrinsic movement is like when you're getting up out of a car. It's not linear. It's kind of diagonal. You're pushing and kind of bracing and moving in a way that is not linear. It's dynamic. So we're looking at getting the pressure off of the nerves that are causing the pain in your knee that are only the width of an eyelash. We're looking at how can we get the pressure off of those nerves. So intrinsic movement is slight rotation, side to side, forward and back, apart and together, and tilting of the knee joint. And in working with those intrinsic movements, we begin to look for where the pressure gets off of those nerves and you begin to feel relief. So step 2 is using the intrinsic movement of the knee joint to get the pressure off of the nerves causing the pain. Step 3 is hold in that position of comfort until you feel a neurological shift. And what am I talking about, a neurological shift? When the knee is in pain, the neurology of your body has locked on to that position of discomfort. Your neurology has locked on to that position of discomfort, which is why your body tenses up. You feel pain, it's like, oh, hi, right? Body locks on to that. You have a neurological response to the pain. Now what we're doing is we're looking to reverse that. So instead of being a victim to that experience of pain, now we're kind of taking that power back and we're going, how can I move this knee so instead of my body tensing up because of the pain, it starts to relax because of the comfort. This is huge, hugely important. And in that position of comfort, we're waiting for a neurological shift. What does a neurological shift look like? If you've ever had that experience, right in the evening, you may be laying in a chair, sitting in a chair, or laying on the couch, or in bed, and you're just kind of drifting off. Your eyes are getting sleepy, and your mind starts to wander a little bit, and all of a sudden it feels like you fell off a cliff and you jerk. That's a neurological response your body gives to switching from the tense state you were in throughout the entire day to a parasympathetic state, or rested and relaxed state as you're moving into the evening before you're falling asleep. In that case, that is a completely involuntary experience your nervous system has. What we're doing is by looking at the intrinsic movement of the knee joint, we're now making it from an unconscious response your nervous system has to letting go of tension to now making it a conscious response. So you're holding that position of comfort until that neurological shift happens. And then step 4, we're going to recheck that area of the knee. So we've pointed to it. My kneecap hurts. The back of my knee below the knee joint hurts. Inside below the knee joint hurts. Outside of the knee above the knee joint hurts. We've taken these places We've worked with the intrinsic movement of these areas of the knee, waiting for that neurological response, and then we're waiting for a change. Now, it could be the jerk. It could be your body relaxes. It could be you feel warmth or cold in the knee, up and down the leg. You could feel twitching in other parts of the body. This is all the nervous system's response, just like that jerk right before you falling asleep. Your entire body is involved in this experience of shifting from a tense state where you have knee pain to a relaxed state where you don't have knee pain, or the knee pain is reduced or shifted or changed in some way. Then you go back, you're rechecking this spot. Is it different? Does it feel different? Has the pain moved? Has the pain changed? Is my knee more relaxed? Do I have a greater range of movement or motion in the knee? Does that spot feel the same? Now here's the trap. Because the mind focuses on pain, we're not looking for the pain to be completely gone. We're looking for the quality of what was going on in the knee before to be different after as a result of introducing comfort. This is going to be the biggest challenge that I've seen in the past 21 years working with clients, helping them out of knee pain, is getting over the entrainment of specifically looking for pain and not seeing the distinctions and nuances as a result of introducing comfort. That's your biggest challenge. And that's for step number 5 when you go to recheck that part. The trap is the knee still hurts. The greater opportunity is the quality of how the knee feels is different. And now that begins to illuminate the path in which you're able to rid yourself of knee pain, which is how to rid knee pain. Now you're like, okay, Bill, you didn't demonstrate anything. I have a training. I have a series. It's a 7-day challenge that goes into these concepts and principles over a 7-day period. It gives you one stretch to begin to work with the intrinsic movement of your knee to relieve what's going on as far as what's in the knee. You can head over to my website, thekneepainguru.com, and you can check that out. That can be extremely helpful for you. There's layers to this. That a holistic approach, a different approach other than strengthening the muscles in the legs or stretching the legs or conventional physical therapy or exercise. If you're looking for something different, it's not going to look like what you've been looking at. It's going to be different. So you can check that out over at thekneepainguru.com. I'll throw the link in the comments section where you can go check that out. I see some questions coming in. If you do have questions, you can head on over to the comments section and put those in over on the side, and I'll get to those. Like right now. Okay, Mohammed writes, "Dear sir, I belong to Pakistan. A few days ago, I shared my accident story with you. Occurred on the 7th of February, as well as about my knee surgery held on the 16th of February. From the day the cast was removed on the 5th of April, I'm still unable to bend my knee, not more than 60 degrees. I'm so much confused about the 7-day knee pain reduction challenge. Now my surgeon has advised me for the MUA. Manipulation under anesthesia. Kindly advise me." You're going to have to write, Mohammed, you're going to have to write more about what you're confused about with the 7-day challenge. The 7-day challenge is specifically about working with the intrinsic movement of the knee joint in a rotational plane of the lower part of the leg. 99 out of 100 people that have knee pain have this pattern going on in the lower part of their leg that prevents the knee from bending fully or extending fully, or to be able to walk without pain. This pattern presents itself in the knee as a result of the body tensing up to protect itself from the experience of the pain, of the discomfort in the knee. So as you're going through the 7-day challenge, it's educating you on looking for the different cues as to what may be going on in your knee. A lot of times we're constantly getting input. The body is constantly shifting and changing and adjusting, which is why knee pain is never the same 2 days in a row. Some days it's worse, some days it's better, some days it moves. And instead of it being like this random occurrence of, well, the knee hurts some days and it doesn't hurt others, and I can't make the connection why, there's always a connection. That's the cool part, is there always a connection. The fact that you don't know why is the whole process of understanding your body on a deeper level. So you know that if the body is, or if the knee is in pain, it's because you haven't drank enough water today. Or maybe the knee is in pain because you had an extra glass of wine the night before. Or maybe you drank too much coffee for breakfast. Or maybe you didn't eat well over the past several days. That's why your body is inflamed and the knee hurts. Maybe it's because there's nerve irritation that you need to address to get the knee joint to relax. Maybe you need to stretch more. Maybe there's mobility work you need to do. Maybe there's exercise that needs to be incorporated. Maybe your very mindset is keeping you stuck in a victim mentality that there isn't anything you can do. There are tons of different ways to look at what's going on in your knee, and it's not like this to pigeonhole what's going on and say, well, it's because my legs aren't strong enough. I've worked with professional athletes that their legs are plenty strong, yet they still have pain. So it's not a function of strength. I've had people say, well, it's because of my weight. Well, there's skinny people that don't have knee pain. There's fat people that don't have knee pain. So it's not because of weight, although these are factors that contribute to it. So we need to look at all of these different dynamics and say, hey, how do we rid your knee pain? Because everybody's different. So, Mohammed, you're going to have to give me more in terms of what specifically you don't understand. Beverly, I started your program and received 70 to 80% relief. Beverly, which program are you working with? And why I'm saying is because I have different, it's all the same program. It's just like different levels of the same program, different support. Some you work strictly on your own. Some you work with my help in a group context. Others you're working with me one-on-one. So I'm curious, which one are you working with that you have received 70 and 80% relief? Which, by the way, I am tickled to hear. That's awesome to know. And I've had people just take the 7-day knee pain reduction challenge and have a tremendous amount of relief that they've experienced. However, I'd encourage you're working on your own. Which program? And this is where specificity, nuance, distinctions and nuance make the world of difference between whether you're in pain or out of pain, because we're talking about the nerves the width of an eyelash that are being irritated, sending a signal to your brain that you have pain. So when working with clients, asking specific questions, looking for specific answers can be the difference between whether you continue in pain or whether you get out of pain. It's important to know how much water you've been drinking, and is it making a difference? Is your body absorbing the water? Because you could be drinking enough water for what your body needs, but if you're running to the bathroom 5 minutes later and peeing it all out because your body doesn't have the right mineral balance to be able to absorb the water is going to keep you stuck in pain. If you're doing the 7-day challenge and feeling that rotation stretch and you get relief for 10 or 15 minutes and then the pain comes back, doesn't mean that the 7-day challenge isn't working. It means your body is too dehydrated to be able to incorporate the water that it needs in order to send the signal through your nervous system. There's a lot of stuff that goes on. We need to know more information. Walking without any aid. I'm not sure. I thought you had one program for knees. And Beverly, I'm asking you specifically, have you done just the 7-day challenge? Have you worked with the comfort zone? Are you working with the Quit Your Quack program? And I know you're not doing private coaching because I would know you. I would remember you. So the point of it is, if you're just doing the 7-day challenge and you've got 70 to 80% relief, are you happy with that? Do you want to get the rest of the pain gone in your knees and start loosening your hips and lower back so you can start walking without even any fear of walking? That's what happens a lot of times. Comfort zone. There we go. Now we're looking at the specificity of what's going on, and that's great. And Beverly, by the way, we do have a members call this afternoon in about an hour and 40 minutes. If you haven't logged in and registered for that call, go ahead and do that, and we can dig in a little bit further. Those are monthly calls that are part of the Comfort Zone program. So there we go. Okay, Mohammed said, is the Ferritic treatment useful for me? I don't know. What is the Ferritic treatment? And usually treatments are from doctors. I do not treat, diagnose, prescribe. I'm presenting information. What you do with that information is completely up to you. The idea is to get you comfortable. Whenever you have buildup of scar tissue, lack of range of motion in the knee joint, stiffness, pain, discomfort, whatever's going on in the knee, it's a result of the nervous system tensing up to protect itself. It's like driving with your foot on the gas and your foot on the brake at the same time. When the nervous system doesn't feel safe from the pain that it's experienced for days, weeks, months, or years, the body tenses up to protect itself. And no matter how much forcing or strengthening or stretching you do on a surface level, on a muscular level, you will never affect permanent change in the knee joint sufficient enough to have the flexibility and mobility that you're trying to get doing all of those surface activities. We have to change what's going on neurologically underneath. The signal that's telling the knee to be tight, the hamstrings to be tight, the quads to be tight. We have to go and change the signaling that's telling the body to tense up and protect itself. So, as far as the Ferritic treatment, you're going to have to ask your doctor. That's a conversation with your doctor. And it's important to understand, and this is what I educate my clients in these videos, is where the role of doctors and physical therapists are and where your role is in your own healing. I have lots of friends that are doctors, and they aren't particularly enthused about the amount of responsibility that their patients put on them for their own healing. A lot of people are lazy. They don't want to do the work. They don't want to do the research. They don't have the discipline to do what it takes to get themselves out of pain. So they make an appointment with the doctor and they show up and they're like, save me. You do it for me. You take care of me because I am not mature enough to take care of myself. And what ends up happening is you end up getting what you deserve. The doctor's like, here's a prescription. You're not paying attention. We'll keep you drugged up. Here's a shot in your knee. There you go. Oh, you want a solution? I'll give you surgery. It'll pay for my second home or this new boat that I'm looking at. And what ends up happening is people ends up in this loop because they aren't taking responsibility for their own health, for what's going on in them. And it's one of those things, you give a kid a hammer, everything's a nail. So you go to a surgeon, when you have knee pain, what do you think they're going to suggest? Of course they're going to suggest surgery. Okay, do we have, we got some other people on here? Have I pissed anybody off? If I have, please put that in the comments section. It'll make for interesting conversation. We have about 6-7 minutes left. I have my group coaching call that takes place at 10:30 Eastern time here. So I will jump off for that. So if you have a few more questions, put those in over in the comments section. Remember to give the video a thumbs up, like and subscribe to my channel, as well as turn on notifications of future videos. Okay, Mohammed says, someone advised me for the ultrasound around the knee joint line daily to break down the scar tissue. Kindly advise me. Okay, Mohammed, you're obviously not hearing what I have to say. I think you're on your own because this is important. I'm not going to continue to give you what my parameters are as far as how I can help, and you not listen to what I have to say. My approach is not in this box. My approach is comprehensive and holistic based on universal principles. The body has the infinite capacity to heal itself. If you put the body in comfort, it changes neurological states that relaxes the tension of what's going on and sets up the conditions by which the body can heal itself. The body also needs the resources in order to do the healing on the other side of the comfort that you create once you get the pressure off of the nerves, which includes, however, not limited to, water, nutrition, breathing, mindset, supplementation, exercise, pain pattern interrupts, stretching, mobility. It's a lot of stuff. And ultrasounds, specialized treatments, those are conversations you have with your doctor. Those are not conversations you ask some guy on the internet. If your doctor is prescribing treatments, then you discuss that with your doctor. And this is part of a lot of people shirking responsibility to do the research to see if it logically makes sense for what's going on in their knee. Mohammed is having difficulty with buildup of scar tissue and range of motion. And we've gone over that several times in the context of this call in terms of how to relax the tension in the joint. When the moment you start relaxing the tension in the joint, you increase the range of motion. Now would be time to ask me where you're not understanding what's going on in my 7-day challenge. Or what I presented earlier in this video in terms of how to rid your knee of pain. So, okay. How are we doing here? Remember to give the video a thumbs up, like and subscribe to my channel, turn on notifications. Also, head over to my website, thekneepainguru.com. I have that 7-day knee pain reduction challenge that'll begin to teach you how to work with the intrinsic movement in the knee joint to begin to get the pressure off of the nerves, get you some relief, like Beverly was sharing. She's actually working with one of a more expanded program called the Comfort Zone, working on her own, working with the different parts of her knee that hurt. It's a simple process. If you could point to where it hurts in your knee, then we can get it out of pain because we can create comfort in that area of the knee. Okay, I'm going to scoot. I'm going to get ready for my coaching call here in a couple minutes. Thank you all for showing up. Thank you for the questions. Appreciate that very much. Head over to the website, thekneepainguru.com. Take the 7-day challenge. Give the video a thumbs up. Like and subscribe to the channel, The Knee Pain Guru, and turn on notifications so you become aware of the videos that I do on different topics on Mondays and Thursdays at 9:55 a.m. So this is Bill Paravano, The Knee Pain Guru. Thanking you so much for being here. Have a wonderful day, and I will see you on the next video.